I am a mother of 3 children.
Meet Kenya's first female radiation oncologist, Dr. Catherine Nyongesa, who has inspired many into the profession.
Now we have many more radiation oncologists.
An oncologist is a doctor who specializes in diagnosing and treating cancer. Catherine and her husband, Dr. Samson Wata, are the co-founders of Texas Cancer Center in Nairobi.
We have seen close to 30,000 cancer patients.
An amazing contribution to Kenya's medical sector as the world marks Breast Cancer Month, October.
Over 60% of the cancers are affecting women.
This and much more about the status of cancer in Kenya and the world, and why you should care to know about the disease.
I was born in Bungoma County in a village called Ebosio, outside my grandmother's house. And I thank God I was lucky. I was born to a teenage mother and I survived, and I thank God for that.
Yes, the alumna of Misiho Girls High School has a story, but let's forward that story.
I got a placement at the University of Nairobi to do medicine and joined in 1989-90, did my 5 years, then went to do internship in Kakamega County Hospital. After doing my internship from there, I now came to Nairobi, and I think coming to Nairobi was one of the eye-openers for me, like daring abroad, because I've been in the countryside. I liked Nairobi. It's a fast town. You have to work hard.
After her studies at the University of Nairobi, Catherine got an opportunity to work at Kenyatta National Hospital.
Then I got a scholarship from the International Atomic Energy Agency to go and pursue a master's degree in oncology. And this led me to the University of Witwatersrand in South Africa, where I was for quite some time studying. It was a degree of 4 years. And there I also learned a lot about the work ethics of people, how hardworking they are, and the education system. You know, you have to work hard and work with passion. Ultimately, after my master's degree, I came back to practice in Kenya.
And they say, east or west, home is the best. What did Catherine bring back home? She brought skills, knowledge, and inspiration as Kenya's first female radiation oncologist.
Being the first woman radiation oncologist in this field, now we have many more radiation oncologists. In fact, our number has grown since late 90s. We are close to 60. So it is commendable that more women are in this field and young men are also in this field.
Catherine's ambition to give back to Kenya's medical sector saw her co-found the famous Texas Cancer Center together with her husband, Dr. Samson Wata. This was in June 2010. Catherine says they were driven by passion for improving patient outcomes through innovative therapies and compassionate care.
We have seen close to 30,000 cancer patients pass through our hands.
A visionary, hard-working couple contributing to many livelihoods. They have employed over 50 people at this facility. And more inspiring, you will be surprised to learn that Dr. Wata is a former police officer.
Yeah, but now he changed the career, became a pharmacist and practiced pharmacy in the US, Texas in Houston.
But where did the name Texas Cancer Center come from?
We have a child, our last born baby was born in Texas, and also the biggest cancer center in the world is in Texas, America. So all those things, maybe they just made us call it Texas. And when I went to US also, I saw the work ethics of people there, because I got a scholarship to to rotate at the MD Anderson Cancer Center, and I saw how they were doing their things, treating their patients, and it was very impressive. And based on that, I said, when I grow up, when we have a unit, we may call it Texas.
Dr. Nyongesa is a busy doctor, offering her services in various hospitals.
I practice in public sector. I work at Kenyatta Hospital. I consult in other hospitals like the Nairobi Hospital, the Nairobi West, Mata, Avenue Hospital, South B, Coptic. So all those hospitals have seen cancer patients.
And October being Breast Cancer Month, let's now delve into the status of cancer in Kenya. Statistics indicate that in 2022, there were over 44,000 new cases of cancer in Kenya. The number of deaths registered was 29,317.
In our community, we see over 60% of the cancers are affecting women, or maybe just their health-seeking behavior. Women are better at health-seeking behavior than men. The commonest in women include breast cancer and cervical cancer. In men, we are seeing a lot of throat cancer, prostate cancer. Those are the common ones. In children, we see blood cancers or leukemias, eye tumors, and kidney tumors. Women spend a lot of time in hospital, maybe taking their children for clinic, or for maybe the children are sick. During pregnancy, women are always visiting the hospital, so they have a better health-seeking behavior. And if there's anything, they can always, I tell the doctor that, oh, I'm having this and this. Apart from that, like cervical cancer, it's because of human papillomavirus, and most of our women are not immunized. So that is one of the reasons we're having more women with cervical cancer. Breast cancer could be genetic. It could also be because of reduced breastfeeding of the children, excessive use of oral contraceptives. So it's always good that this contraception is used to moderation, and consult your doctor on how long you should use it. And then for the men, we see a lot of prostate cancer, which is genetic and also because of aging.
Cancer is a leading cause of death worldwide, accounting for nearly 10 million deaths in 2020, or nearly 1 in 6 deaths. Around 1/3 of deaths from cancer are due to tobacco use, high body mass index, alcohol consumption, low fruit and vegetable intake, and lack of physical activity. In addition, air pollution is an important risk factor for lung cancer. The most common cancers globally in 2020 in terms of new cases were as follows.
Use of tobacco increases your risk of cancer. Alcohol, excessive use of alcohol increases the risk. Sun exposure can put you at risk of skin cancer. Chemicals, excessive exposure to chemicals like maybe fertilizers, you have to use them to moderation. Pesticides can also maybe predispose you to cancer. We have aflatoxins, so good storage of food is very key. So we avoid aflatoxins causing cancer.
Kenyans are advised to embrace cancer screening as per the National Cancer Screening Guidelines.
People should be very proactive in going for these checkups, just to, even if it's once a year, be proactive, go for screening. When you go for screening, you don't have symptoms. You are very well going around your normal duties, but just go for that screening where they'll check your blood pressure, they'll check your sugar, they'll check your heart, they'll check you for, if you're a woman, they'll check you for breast and cervical cancer. If you're a man, you'll also be screened for breast cancer, for prostate cancer, throat cancer, lung cancer. So all those are possible to be screened for.
Diagnosis of cancer in Kenya has improved a great deal with the introduction of what is known as PET scan in hospitals like Kenyatta University Teaching and Referral Hospital.
We collaborate a lot with Kenyatta, we call it KUTRRH, in terms of imaging. Imaging, they have a PET scan that is used for staging of cancer to know how far it has spread in the body. Not all cancer cases need a PET scan, but on special occasions or special cases that need that PET scan, we always refer them for the same. So how we do it is we have an online booking system where we do all the paperwork for the patients and we post it to KU. Once they receive it, they will only call the patient to go for the imaging.
In the new health insurance scheme, diagnosis of cancer is covered up to 100,000 Kenya shillings per patient per year, with treatment being covered up to 400,000 Kenya shillings under the Social Health Insurance Fund Cancer Benefit Package. And with the Primary Healthcare Fund, there should be budget allocation from national government, which is instrumental in cancer screening, prevention and early detection.
There are three top diseases that are ailing our country, our people. Number one is cardiovascular diseases. These are your high blood pressure, uncontrolled high blood pressure, poorly treated diabetes can lead to heart complications, and that is one of the most serious ailments. This is followed by infections, malaria, pneumonia, typhoid, and other bacterial infections, viral infections, HIV included. So these are now the second leading cause of death in our community. Cancer comes in number 3.
And that's a glimpse of the status of cancer in Kenya through the eyes of Dr. Catherine Nyongesa, Kenya's first female radiation oncologist and co-founder of Texas Cancer Center.